So this patient, he had a bow leg and he want lengthening as well. So why he choose Dr. Amar Sarin and India especially? Hi, this is Sharik from Dr. Amar Sarin Limb Lengthening team. Today we have a patient from overseas and he is just 21. Why he did limb lengthening surgery and especially why did he choose Dr. Amar Sarin? He will explain.
Hello, I am 21 years old and I am from the overseas. I did my surgery around 1 week ago and I came to India. I came to Dr. Amar Sarin 1 month back because initially the plan was I have got deformity in my leg, the bow legs. So I was worried about that, and that was one of my major concerns for this surgery. But then later on in research, when I tried researching everywhere, I found out that there is an option with the deformity. You can get the lengthening as well because of the deformity. I had my height stopped at a certain age very early, so I was around 5'2" and 5'3". So I was depressed considering my height as well. And later on, after a couple of research, I tried abroad, other countries. The price point and also the visa and everything, it was very complicated. So and I saw about Dr. Amar Sarin in the online, and I contacted his assistant, Mr. Sharik. Mashallah, he's a very cool first day. It's been a long journey, yani it's been 2 or 3 months since I've been in Mr. Sharik's touch, and he's been guiding me and telling me and my parents everything about the surgery. So I came 1 month back. I was not really satisfied or to do with the surgery. I was in a 50-50 state. So Mr. Sharik, he suggested me that you spend time with the patients here for around 15 days or so, and then you can go and look out India. You can just look out outside this.
I gave you the time.
Yeah, he gave me the time.
That make your mind.
Exactly, and that's when I started trusting completely, and I understood that this is the best place I could come and get the surgery done. So alhamdulillah, last week I got my surgery done on my tibias, and I'm so forth. I'm very happy, and let's see how the journey continues. We'll keep you updated, inshallah.
So Muhammad, simultaneously we are correcting your bow legs and as well as you are getting your leg lengthened. So what is your target?
Yes, of course. Regarding my bow legs, I had too much deformity on the legs, so that was the primary reason for me to, yani, in the beginning initially to check for this. And whichever doctor I used to see, I used to consult, he used to tell me to go for the correction surgery first, and then you can go for anything else. But then when I met Dr. Amar Sarin, alhamdulillah, he looked at my X-rays and he told me that wait, don't worry, we can get the limb lengthening as well as the deformity correction together in one stretch, in one go. So until the day of the surgery, I was very confused, and because I'm very skeptical about this. But alhamdulillah, when I came here, I got the surgery done. The next day when Dr. Amar, he showed me the X-rays, I was astonished and I was surprised to say that mashallah, that he surprisingly he did the correction of the bow legs as well as the lengthening. So I was very happy because I was very concerned about the lengthening. And yes, the thing about Dr. Amar Sarin is, he is consolidating for his patients.
So how was Muhammad experience in hospital and in our rehabilitation center? He will explain you.
Alhamdulillah, my experience in the hospital as well as the rehabilitation center was very good, mashallah, because initially in the beginning of the surgery, prior to the surgery, 1 day prior to the surgery, they take you to the hospital where they do your tests, very simple and easy tests, the blood reports and everything. And the next day, on the day of the surgery, before the surgery, the doctor comes to you and he has a chat with you, a motivating chat, and he gives you a very peaceful and calm smile, which lifts you up before the surgery. Mashallah, that's what I liked about Dr. Amar Sarin. And after the surgery, they shift you to the private room on that day itself, where you were taken care under the nurses and the staff of the hospital, who are very they're very good, they're good in their profession, they're skillful, and you have to stay there for a couple of days. You will have anesthesia and painkillers, because initially the pain is going to stay, the pain is going to be there. Initially it's going to be raw after the surgery, but it'll be easy because you'll have painkillers, anesthesia, and immediately the stuff and the nurses will come within no time whenever you call them. And after that you will be shifted to the rehabilitation center after 4 or 5 days of the surgery, and there will be Mr. Sharik and his team who are very gentle and very exceptional. You'll feel very happy with them. And initially I had thought that yani, it will be very depressing and painful, this surgery, but then mashallah, even the patients, the mates which you are surrounded by, they're like family to you. They'll always uplift you, and you will have a very beautiful time ahead. And my experiences, alhamdulillah, until date is getting better and better, and hopefully that's what I would want to say.
Thank you, Mohammed.
Welcome.